everyone, I'm your fave nurse B. Today we have yet another study video. So I am going to be talking about concept maps. So the way that a teacher explained it to me is basically you take an idea or a concept or an ideal, a theory, whatever the case may be, and you put it in the middle of a piece of paper and you just blow it up. So you put everything about that, you just go from there. And it really reminds me of like brainstorming. Remember when you were in school and you had to like brainstorm different ideas? So you'll put something in the middle and you just kind of like branch off of that. And you'll branch off of that idea and branch off. So it's kind of like that. And I found it to be very, very helpful. She was the only teacher that went over it. And of course, I think it was like in the second, like towards the end of our schooling when we learned about it. I was like, why the heck did we not learn about this long ago? Like, because it's so helpful. And it really helps me because I'm a very like information heavy person. Like I like to have a lot of information in one place. Of course, for you, you can put as much or as little as you want on your concept map. It's completely up to you and how you learn and how you process things. Just for me, I like to have a lot on one piece of paper. I don't know why. I don't want to shuffle through a lot of people. I want to just have one piece of paper with everything I need to know about that disease, that drug, whatever the case may be. You can use this really for any subject, but I'm going to be talking about diabetes in this video because I know it's like really big in nursing. Well, in healthcare, a lot of people have diabetes and it's just a disease that you really should know, and I just felt like it was something to go over, like it had a lot of information. You can do these in prerequisites, nursing classes, anything really that you need to, if you have a big idea and you really need to break it up and see it from different angles, concept maps will help you. Definitely show this video and this channel some love by liking this video, subscribing, and commenting. And if you want to, please share. Sharing is caring. So the book that we're going to be going out of is this Intro to Med-Surg Nursing for my LPN program I went to, what, 3 years ago. So the disease we're looking at is diabetes. Now, diabetes is a huge disease as far as the complications and the treatment and all these different things that it deals with. So I will be doing 2 separate concept maps just so that it's not so cluttered. Okay, so the first thing that you look at when you're trying to learn a disease is you need to look at the pathophysiology of that disease. Now this is going to show you what the disease actually is and what it's doing in your body that's causing you to have issues. You do it horizontal or vertical, whatever you prefer. I like to usually do it horizontal. So starting at the top. And then the thing that you need to know about diabetes, there's a type 1 and a type 2, and there's the causes for them are different, and also the treatment is different. So I'm going to actually divide this up between type 1 and type 2. So I'm going to put patho. You could put you could do whatever you want. You could put boxes, you could put lines, circles, whatever. I'm just doing this, you all. Of course you can do it neater. I'm just doing it. And then overall at the end of the day, diabetes is hyperglycemia. At the end of the day, type 1, and then over here type 2. So we got that. And then what happens with diabetes and type 1 is that they do not have endogenous insulin, meaning that they don't have insulin. Endogenous means coming from your body. Exogenous means something that's an external supply coming into your body. So they don't have endogenous insulin. The thing with type 2, it's a lot more complicated. They do not use their body's insulin. And this is due. So I'm doing these arrows to kind of show like why this is happening. Like, so they don't have insulin. The thing with them is they are producing insulin, but their body's not using it properly. So since their body's not using it properly, then it's going to increase their blood sugars, which then their beta cells are desensitized. So beta cells are am I spelling this right, y'all? Sensitized. And then this leads to insulin resistant. They become insulin resistant. So that's the whole disease process for type 2, and for type 1, that's the pathophysiology of those 2 separate types of diabetes. So with that being said, but at the end of the day, both of this leads to hyperglycemia. All right, so we're gonna go into the causes of it. Now you can put boxes around it, whatever you want to do. I'm just gonna do a little line from here and put causes. So over here, so this is interesting. For the most part, we know that type 1 diabetes is genetic. It's a genetic predisposition to it. But also something I learned in nursing school that I thought was like really interesting is that it's also considered like environmental, meaning that it can come from toxins or a virus. So that's really interesting to me. I mean, but at the end of the day, it is an autoimmune response. So this is the case for both diseases. So you see how in the middle I'm putting the commonality between the two diseases. So this means that your body is actually destroying healthy cells. Your body is attacking itself with this disease on both sides. So this is an autoimmune response. Okay, so with type 2, now y'all, it's a lot of causes, and then causes also means risk factors as well. So you could put risk factors or causes. It's the same thing. So with type 2, it's more so geared towards a person's lifestyle, but there could also be other things attributed to it, but it's mostly a person's lifestyle. So the biggest thing would be obesity. 2 would be a sedentary lifestyle, meaning you don't do anything. You're a couch potato, basically. You're just not an active person. And then if you are, above or equal to the age of 40, if you have a history of gestational, I spelled that wrong, gestational diabetes, the sugar, honey. Or if you also had a baby that was more than 10 pounds, more than or equal to 10 pounds. Okay, so in the book it was saying like all these different ethnicities. So it was like Hispanic, Pacific Islanders, it even had Asians, all that good stuff. So basically it was like every race with the exception of Caucasian. So I'm gonna just put non-Caucasians. All right. And then also, if you have any type of history of cardiovascular disease or hypertension. And then also, they had on here polycystic ovarian syndrome. So as you can see, this took up basically our whole sheet. Now, like I said, you can make this neater, you can make it brighter, you can do highlighting and all that good stuff. I'm gonna go ahead and do it a little bit different. We're gonna put diabetes right in the middle, the diagnosis. So we can branch off of that. And of course, you all throughout this whole process, you can do like shorthand, however you do any of your notes. You can write as many or as least amount of words as possible. So with the diagnosis, they look at your symptoms. So we're gonna put polyuria, which is a whole lot of urine. You're just peeing all the freaking time. And then polydipsia, which is your extreme hunger. You're always hungry. Now, if you have a random blood sugar equal to or more than 200, random meaning this is not based off of when you ate or anything like that, and it's not fasting. It's just anytime throughout the day you check your sugar and you're at or above 200. Also, unexplained weight loss, which this has to do with what was it I was looking at? It has to do like with the protein in your body, because since your body isn't using insulin properly, it starts to break down the protein in your body, and that can cause you to have weight loss. I believe that's the reason. I was looking at it in the book. I was like, oh yeah, I'm like relearning this stuff, y'all. It's crazy. And then also a fasting blood sugar more than or equal to 126, and this is 8 hours after meals. So like I said, my book is like 3 years older, so of course you go by what is in your book. This is just me showing you what I got from the book and just showing you the process. The actual content of it, you know, you have to go off what your professor says and what you see in your actual book based off the time, you know, that you're doing this. But anyway, so those are the diagnoses. Now you can make this into like a little bubble, you can make it into a box, or you can kind of leave this like freestanding as far as the information. Like I said, you can circle it, whatever, we'll leave it free for now. Okay, so also diagnosis, they also look at a oral glucose tolerance test. If you're pregnant or ever been pregnant, then you know what this test is. Basically, you have to drink that really, really sugary drink after not eating for a certain amount of time. And then they check your blood levels after that, and they see if your body was able to produce the insulin and everything that needs to be done for you to bring down that blood sugar. Treatment is very important. This is where you really step in as a nurse. Because as a nurse, for the most part, you are going to be teaching treatment. You're going to be actually implementing the treatment with your patients, whether you're checking blood sugars, giving insulin, ordering tests, doing the tests for the patients, whatever the case may be. Is a change in diet and exercise. Also, you need to get routine blood work and maintain levels. So that could be like your doctor might check your blood sugars, your what else? Like your actual glucose level. Usually they do that like every 3 months. It's called hemoglobin A1C. They'll do it like every 3 months. And then they'll also check like your blood pressure. They might want to check your cholesterol to see, because diabetes causes so many diseases within the body. And we'll talk about that. But anyways, they also want to prevent / treat any type of chronic and acute complications, which we're going to talk about. Weight, attain, and maintain. So your doctor might tell you, I did not spell that right. Anyways, your doctor might tell you, hey, you need to lose 30 pounds or whatever that really helps you. You need to get to that point and you need to maintain that weight. Let's see. And then also, this is really big with nurses, is daily blood sugar checks. Just depends on the regimen that you're on. You might have to do it before meals, at night, early in the morning, whatever the case may be. Now, this is the treatment. Underneath treatment, I'm going to put medications. Now, like I said, diabetes is a huge disease, and so you could do just freaking one concept map just on diabetic medications, all the different classes. You could do one for all the different insulins, all that good stuff. But basically, we're gonna shorten it up and we're gonna put insulin, and I'm just gonna put like some little examples, which could be like Lantus or Humalog, etc. And then also you might have to take an oral hypoglycemic agent. So something that's gonna decrease your blood sugar. So this could be like metformin or Anglanza. How do you spell that? Anglanza. All right, so that's that. Go out a little bit. So we got diabetes, we got the diagnosis, which is important because if you're a nurse and you have like somebody in your family, or you have a patient that's telling you, hey, I gotta keep using the bathroom, I gotta use the bathroom, I gotta use the bathroom. And you know, in geriatrics, we usually think, oh, they have a UTI. But if we notice that they don't have any issues with that, it might be something going on with their sugar, or they're always thirsty. Did I say dyspepsia? Wrong. When I said polydipsia, I meant to say that it's excessive drinking, like they're extremely thirsty. I don't know why I said that. So increased thirst, and then you can put here increased urination. I don't know why I said that for hunger, but there is one where they get really hungry too. That is a symptom too. But anyways, increased thirst is a big symptom. Okay. So coming on over here, I left all this space because for complications, because there's a lot of complications that can come from diabetes. We might not use all of it, but whatever. So we're gonna put over here first chronic. All right, so under chronic, there's a few different subsets to that. So the first one we're gonna do is macrovascular. So diabetes really affects your cardiovascular system because it's dealing with the increased sugar in your blood. It makes your blood very thick, very viscous, and it can really damage your vessels, and that can cause you to have cardiovascular issues. So when we're talking about macrovascular, these are bigger arteries and veins that are being affected. So this, underneath this, I'll just underline it. Underneath that, you can have what is called atherosclerotic plaque. All right, build up in your actual the walls of your actual arteries. You can have that. Now what that leads to is coronary artery disease, CVA or stroke, heart disease, and also PVD, peripheral vascular disease. Now of course, if you need to, write out the full disease, but kind of get used to using acronyms, because you see that a lot, especially when you look at like transcripts from the hospitals or like history and physicals. A lot of times they actually put the acronyms versus the actual disease, which is super helpful to do, because as you can see, if I had to spell all that out, honey, this would be real long. So this is the macrovascular issues that you could have associated with chronic complications from diabetes. Now we want to go down to microvascular. So we're looking at smaller arteries, or basically smaller blood vessels. So these are macro. I'm just going to kind of spawn off of that. And so with micro, a lot of times with micro, you're looking at a person's eyes. So this could be issues with your eyes that could lead to blindness. You can also have issues with your kidneys, which, I mean, that's just so horrible. But it could lead to you having, it's like one of the biggest contributing factors, diabetes is one of the biggest contributing factors to end-stage renal disease. So, you know, you could have diabetes and you could be starting to have to be on, dialysis and things like that. So this disease is just one of those things that you want to prevent at all costs. Yeah, prevent it at all costs. I remember learning about this in school. I was like, oh my gosh, I didn't realize how much can happen just from this one disease. It's crazy. Now we can look at acute complications. All right, this is what you really need to be looking at as a nurse, because these are those changes that you need to be able to assess and do something about as soon as possible, because it's so acute. It's one of those things that anything can happen. So you have to really look out for these. So the biggest thing that a person looks at is a diabetic ketoacidosis. Very, very high blood sugar paired with ketones. Increase of ketones in a person's system. That's why it's ketoacidosis. So basically your body is being pushed into an acidic state, and it's oh my gosh, this focus. Anyways, basically your body is being pushed into a very acidic state. It's very complicated to treat it because you're like, okay, your sugar's so high, we need to give you more insulin, but your body's not using the insulin, and then it's like a domino. So it just gets horrible. So with this, usually they treat it with fluids. Now you can go further into this if you had to, and put like, you could just do a concept map just on diabetic ketoacidosis. You can do the causes, you can do the signs and symptoms, you can do the treatment for it, and then you can do like prevention, that type of thing. And that could be one big concept map. But right here, we're just gonna kind of sum it up as easily as we can. Hypoglycemia, which this is more so a complication based off your treatment. So if a person is getting too much insulin, say you gave them insulin, they said, oh, you know what, I'm not gonna eat lunch. Well, I just gave you 10 units of Humalog and you don't want to eat lunch, so guess what, your sugar's gonna go down, you know? So this is a complication of that. And then you can even look at the complications and see from the complications, what do you do to treat the complications? So that's that, you all. Let me just show you some of the maps that I did while I was in school. I was a lot more organized while I was in school. The one I showed you in the video is not so like pretty looking, but let me show you all some of the ones I did while I was in nursing school. All right, so this is one of the maps that I did. It was about drugs, and I look at looking back on like my notes, I did a lot of concept maps from drugs. So if you all want me to do like a pharmacology concept map video, please let me know. But this is one that's on, let's see, progressive systemic sclerosis, scleroderma. Okay, scleroderma. Okay, scleroderma. So this one is really neat. As you can see, I have my Patho, the causes, the different types that they have, and then I have like this little, I forgot what this thing is called when you do that and you branch off, but I like that. That's a good way to learn stuff, to do it like that. And then over here I have signs and symptoms, and of course I didn't put medical diagnosis, or I didn't finish this. But every time that I do concept maps, I love to put them in these sleeves because it keeps them nice and clean, you all. I love to keep my study material clean, because what's the point of doing all this and it gets wet and nasty and crusty and all that good stuff? No. Put it, invest $1, go to the dollar store and get some of these sleeves and put them in here, and it'll just make everything look better. And so rheumatoid arthritis. And yes, like you can see, you can use different colors, different highlighters. You can really use anything to make it easier for you to understand. You can put in, let me see if it's on here. Pharmacology one, like you could put in different like little photos, little stick drawings, that kind of helps you to remember. Like I put right here alopecia, I put like a little bitty ponytail and like some hair like falling off. I don't know, y'all was so extra. But anyways, right here for headache, I put like a little person, and it looks like it's so much pain from their head, you know, whatever. So there's some of the examples that I made while I was in nursing school, y'all. This is like legit from nursing school. It's crazy that I kept all this stuff. This one is really nice. I don't know, just looking at it, it just looks so organized. It just looks so put together, and you have everything you need on here. And you can use, as you can see, I just use scrap paper to do it. Like, don't use fresh paper. Use that scrap paper that you accidentally printed off, something wrong, whatever. Use that to do it. But it's perfect, yeah. I love organizing information, by the way of concept mapping. Okay, and it can look any way you want. It doesn't have to look any type of way. You can make it your own as you start doing it. So please let me know if you all found this video to be helpful. I hope you did. Like, I had a good time doing it. I really like to look over my old notes from nursing school. I'm like, you know what, your girl was legit. But anyways, I will be posting some of these photographs on the YourFavNurseB Facebook group of some of my old concept maps and the one that I did for this video. So go check it out. Go follow me on Instagram. Yeah, I'm pregnant. And oh, I'm pregnant. I don't know if y'all knew that. Go check it out on my second channel, Stay Forever True. It's a vlogging mommy lifestyle channel. Go check that out. So if you notice in some of my videos I'm a little like winded, or I look like, girl, what's up? that's why. But yeah, I hope you all enjoyed this video. Please continue to show this channel so much love, because I really appreciate you all. So like I said, like this video, comment and subscribe, and share it if you like. Okay, peace.